welcome guests. So I hear you wanted a tour of my beautiful hospital, and it's not a problem whatsoever, but please just don't disturb the patients. Now, as we're walking around, you may notice that some of our doctors and surgeons are all male, all of them. That's because women aren't really known for having a lot of jobs. The jobs that they can find are usually like sales girls and cashiers, secretaries, maids and cooks, school teachers, telephone operators, midwifery, and of course nursing, which I have chosen as my profession. Some lower class women, however, have started to work as wet nurses. Now, don't be scared if you don't know the term. Wet nurses are just lower class women who have recently had a child, and they decided to go up to the upper class to get some money for nursing the upper class's children, which is no problem. It may be a little awkward in some areas, but while they're away in these upper class areas, their children at home are starving to death, which is a very sad thing because we are always attached to our children. In the meantime, the more conventional nurses, like Florence Nightingale, are working with a typical patient, like the military people, who are all missing limbs or sick with disease. Now, Florence Nightingale is a famous nurse known as a self-sacrificing ministering angel, and she's known for comforting all of her wounded soldiers. She helped to raise the bar for women and help the women to be more accepted in the things that they do, such as nursing. As time moves on, the medicine has kind of moved on from all the bleeding and vomiting and prayer, which of course bring the best results. But now we have this amazing concept of the germ theory. The germ theory was practiced on milk at first and figuring out why it molded, but now we realize that germs are just unsanitary. So when doctors and surgeons are working on their patients, they can be more sanitary and actually help to keep some limbs for their patients. Also, we have gotten a new thing called anesthesia. Now, this drug helps to give doctors and surgeons more time in the operating room, so they can take their time instead of losing so much blood and rushing through the surgery, and they don't have to worry about their patient being in too much pain. Also, we have these things called laxatives. Now, we still have this theory of things being let out of our system, like there's a sort of imbalance with all the chemicals inside us. Laxatives and bleeding and vomiting all reject this evil substance within us. As for the rest of the population, a large majority of people are living in one concentrated area, and in this concentrated area there are so many diseases, mostly because of all the unsanitary things that we do, like the toilet system, pretty much just our excess waste going along the street, which allows for more disease everywhere. These diseases can range from something not so bad, but it could go from smallpox to typhus to tuberculosis and cholera, which is pretty much just diarrhea and you're completely dehydrated and you die. So we have moved on in a sense, and we are using all of these new ideas on our patients here after they come back from the war, after they are injured.